Every 40 seconds, someone in America suffers a stroke. But here's what could save your life or someone you love. Before we dive into these critical warning signs, I need you to do something important. Hit that like button, subscribe, and most importantly, watch this entire video. Because the most crucial information comes at the end, and missing it could be the difference between life and death. Let's begin with the 5 early warning signs you absolutely must know. Warning sign number 1, sudden facial drooping or numbness. This happens when blood flow to the brain area, controlling facial muscles, gets interrupted. Ask the person to smile. If one side of their face droops or feels numb, this is a major red flag. You might also notice drooping in the eyelid or eyebrow on the affected side. The key here is sudden onset. If this happens suddenly, don't wait. Every minute counts because brain cells are dying without proper blood flow. But caught early, facial function can often be restored completely. Teach your family this simple test. It could save a life, and that life could be yours. Warning sign number 2, sudden arm weakness or numbness. When stroke affects the motor cortex, it disrupts signals to your muscles. Here's the test. Ask them to raise both arms above their head for 10 seconds. If one arm drifts downward or they can't keep it up, that's a stroke sign. You might also notice weakness in their grip or difficulty holding objects. This happens because the brain's motor control center isn't getting the oxygen it needs. Sometimes the weakness is subtle at first, but it will progressively get worse. Don't dismiss weakness as fatigue. If it's sudden and one-sided, call for help immediately. Warning sign number 3, sudden speech difficulties or confusion. Stroke can affect your brain's language centers in several devastating ways. You might notice slurred speech, like they're intoxicated but they haven't been drinking. Or they might have trouble understanding what you're saying to them. They know what they want to say, but the words just won't come out right. This happens when blood flow to language processing areas gets cut off. Test this by asking them to repeat a simple sentence like, "The sky is blue." They might also have trouble writing or reading. Any sudden change in speech or understanding requires immediate medical attention. Warning sign number 4, sudden vision loss or visual disturbances. This can range from complete vision loss in one eye to partial blind spots. You might lose vision in half of your visual field, even though your eyes are fine. That's because stroke damages the brain's visual processing center, not the eyes themselves. Some people experience double vision or see objects jumping around. Vision problems often come with dizziness because your brain can't process spatial information properly. Test by covering one eye then the other. Any sudden change in vision is an emergency. Quick treatment can often restore vision, but only if you act fast. Warning sign number 5, sudden severe headache unlike anything you've experienced before. This isn't your typical headache. Stroke patients describe it as the worst headache of their life. This happens when a blood vessel in your brain ruptures, causing bleeding and pressure. It often comes with nausea, vomiting, and extreme sensitivity to light. The key word is sudden. It hits like a thunderclap, reaching maximum intensity within seconds. This type of headache requires immediate emergency medical attention. You might also notice neck stiffness or pain when trying to touch your chin to your chest. The bleeding creates pressure that can quickly become life-threatening. Every minute of delay increases the risk of permanent brain damage or death. Remember the acronym FAST to identify stroke quickly. F for face drooping, A for arm weakness, S for speech difficulty, T for time to call 911. Don't drive to the hospital yourself. Call 911 immediately. Paramedics can start treatment immediately and alert the hospital you're coming. This gives doctors precious time to prepare life-saving treatments. The most effective treatments must be given within 3 to 4.5 hours of symptom onset. You now have knowledge that could save a life, maybe even your own. If this video helped you, please hit that like button and subscribe for more life-saving health information. Leave a comment below sharing this with someone who needs to see it. Share this video with your family and friends because stroke doesn't discriminate. Subscribe and hit the notification bell so you never miss our latest health tips and medical insights. Together, we can spread awareness and save lives. Thank you for watching, and remember, knowledge is your best medicine.